We're now going to turn our attention to the lower respiratory system, and so that's all of the organs of the respiratory system inferior to the larynx. So we're going to follow air from the larynx into the trachea, and then the trachea is going to split into a right and left bronchus, and air is going to enter the lungs. The lungs take up most of the space of the thoracic cavity. The apex of the lung is right beneath the clavicle, and the base rests on top of the diaphragm. The right lung is bigger than the left lung, and in fact it has three lobes: a superior, middle, and inferior lobe, while the left lung has a superior and an inferior lobe. We refer to this model as the lung and heart model. I'm going to identify a few structures of the upper respiratory system and then move to the lower respiratory system, specifically the lungs. Here you have the hyoid bone, thyroid cartilage, cricoid cartilage, and then begins the trachea. This is the right lung, which has three lobes: superior, middle, and then down here is the inferior lobe. And on the left lung we have the superior lobe and the inferior lobe. You're now looking at a transverse section of the thoracic cavity. You see here the heart, and you see the right and left lungs. I'm going to use this figure to illustrate the pleural membrane. The pleural membranes are the serous membranes that surround the lungs. If you recall, the serous membranes that surrounded the heart were the pericardial membranes. You had the inner, or I should say the visceral pericardium was the inner membrane, and then you had the parietal pericardium, and then you had the pericardial cavity between the two membranes. Similarly, you have a parietal pleura that lines the thoracic cavity. Then you have the visceral pleura that's attached to the lung tissue, and then the cavity between the two, or space between the two, is called the pleural cavity. If I asked you to identify any of these membranes, it would be from an image. You're now looking at a transverse section of the thoracic cavity. You see here the heart, and you see the right and left lungs. I'm going to use this figure to illustrate the pleural membrane. The pleural membranes are the serous membranes that surround the lungs. If you recall, the serous membranes that surrounded the heart were the pericardial membranes. You had the inner, or I should say the visceral pericardium was the inner membrane, and then you had the parietal pericardium, and then you had the pericardial cavity between the two membranes. Similarly, you have a parietal pleura that lines the thoracic cavity. Then you have the visceral pleura that's attached to the lung tissue, and then the cavity between the two, or space between the two, is called the pleural cavity. If I asked you to identify any of these membranes, it would be from an image. I'd like to take a step back to the trachea and follow air on its way not only to the lungs but through the lungs. So the trachea, as I mentioned, divides into a right and a left bronchus. It's called the primary bronchus or main bronchus. That then divides into secondary bronchi, and then the secondary bronchi divide into tertiary bronchi. And then the tertiary bronchi narrow and change somewhat in their anatomy into a bronchiole, a terminal bronchiole specifically. Collectively, this is referred to as the respiratory tree because it resembles an upside-down bush or tree. Let us now identify structures of the respiratory tree on the respiratory tree model. Here we have the trachea. The trachea divides into a right and left primary bronchus. The primary bronchus divides into secondary bronchi, and the secondary bronchi divide into tertiary bronchi. I want to stress that there are no bronchioles on this model, so please do not identify anything on this model as bronchioles. We only have bronchi. Now let's turn to another image of the respiratory tree, and we're going to move now from the bronchi to the bronchioles and eventually to our final destination, which are the alveolar sacs. Coming off of the tertiary bronchi are the terminal bronchioles. Bronchioles are smaller, have a greater proportion of smooth muscle and a lesser proportion of cartilage compared to the bronchi. Those terminal bronchioles branch into respiratory bronchioles, and now we have now entered the respiratory zone where there's actual gas exchange occurring between the air in the lungs and the pulmonary or the blood of the pulmonary capillaries. These respiratory bronchioles in blindly into the alveolar sacs. I like to think of an alveolar sac like a bunch of grapes, where the alveolar duct would be the stem and the alveoli would be the actual grapes, and collectively they make up the alveolar sac. This is a frontal section of the alveolar sac. You see the alveolar duct here. It's basically the ending of the respiratory bronchioles, and here we have the individual alveoli. We do not have any models of any of these structures here, and so if I asked you to identify the terminal or respiratory bronchioles, alveolar duct, alveoli, or alveolar sac, it would be from an image such as this one. Although not shown on this image, all along the outer surface of these alveoli would be the pulmonary capillaries, and where the walls of the pulmonary capillaries and the walls of the alveoli meet, we have the respiratory membrane. And here is the image of the respiratory membrane taken from your book. Here we have an alveolus. On the outer surface of the alveolus are the pulmonary capillaries. You see several pictured here. Where the wall of the pulmonary capillary and the wall of the alveolus meet, that's where gas exchange occurs, and that is called the respiratory membrane. So blown up here, we see that the wall of the alveolus is composed of a single layer of squamous epithelial cells, and the wall of the capillary, of course, is composed of a single layer of squamous epithelial cells. They share a common basement membrane, and collectively they form the respiratory membrane, across which external gas exchange occurs between the air of the alveolus and the blood of the pulmonary capillaries.